to this story now. A study has shown that South Africa has the 6th highest TB burden worldwide, and COVID-19 has had a significant effect. According to tbfacts.org, 58,000 people in South Africa died of tuberculosis in 2019, and in the same year, the World Health Organization estimated a TB incidence rate of 615 per 100,000 people. Well, for more on this, I'm joined by Dr. Mohammed Rasool, Deputy Director at the Clinical HIV Research Unit. Dr. Rasool, thank you very much for your time. So we have the 6th highest TB burden in the world. What are we doing wrong?
Morning, Xoli, and morning to your listeners. I think there's multiple factors that contribute towards this. South Africa has a high endemic rate of TB, number one, to start with, so we've always had a high TB rate. South Africa has one of the largest HIV programs and HIV burden in the world as well, and that also then contributes towards this. So those are the two major factors that play a role.
Yeah.
And then other factors that will also play a role with regards to TB is the cure rates of TB. TB treatment is long and arduous. Different forms of TB treatment can last up to 2 years historically. And that is a challenge for patients who have to take treatment for so long. That then also contributes to why people then why we don't cure TB. In essence, we know we can cure TB, so TB is curable.
Yeah.
The other factors that come into play.
So talk to us about the impact of COVID-19. How has it affected the fight to cure the patients who suffer from TB?
So COVID-19, I think, has had a drastic effect on not only TB, but a lot of other health services as well. HIV is impacted a lot on your other chronic comorbidities. The system was disrupted. Clinics were not active all the time. It was disrupted by COVID due to staffing getting COVID. Patients are not coming to the clinics because they were afraid of COVID. And those that were able to go to clinics sometimes got to a clinic and found the clinic closed. So, you had patients not being diagnosed. You have patients then who are on treatment, who are unable to get treatment. And these disruptions then are disasters down the line.
Sure.
COVID has had a drastic impact.
And add to that the diversion of funds. We've just listened to the Treatment Action Campaign, who were handing over a memorandum of demands to the Deputy President, who leads the SANEC as its chairperson, and they're saying these are critical funds that not only fight TB but also HIV. How much money has escaped the funding of TB?
I can't speak to the exact figures, but if your funding is going to be distracted or diverted from these programs, then down the line we are in for a big problem. Because as it is, we're expecting that we're going to be playing catch up to the diagnosis of TB for those that haven't come through the system, and all of a sudden we'll see an influx or a surge in our numbers. So. If our funding is diverted, then the poor people are going to suffer at the end of the day.
58,000 people, Dr. Rasool, are said to have died of TB in 2019. And in the same year, the World Health Organization saying that the incidence rate of 615 per 100,000 people is something to worry about. Talk to us about if this fight against TB is left unattended, the consequences it might have for those who are not affected by TB. Might they be at immediate risk?
So, if we don't win the fight against TB, then it will run rampant, because TB is, it's out in the open. It's transmitted in the open. Apologies for that.
No worries.
So I was saying, when TB is out in the open, people gather together, and if you're in close proximity, then the chances are, very high that you would get TB. The other thing that we also have to consider is a large proportion of South Africans actually have the TB bacilli in them, but they don't actually get sick. So that's what we call sort of latent TB. Like I was saying, because TB is endemic in our country, a lot of the population would have been somehow exposed to TB previously, but because the immune systems are still strong, you don't get the active disease. However, when something comes along that would depress your immune system, then that would sort of kickstart the TB, and then you would get the active forms of TB. And that is another challenge in us trying to curb or eradicate TB completely from the population.
Yeah. Final question, Doctor. It is World TB Day. Those commemorations are happening in Mbombela. That's where the Deputy President is going to be. What should he be saying?
Well, he should be saying that anybody that has symptoms that are related to TB should immediately go and test and, try and get a diagnosis. We have treatment that works. We've made strides in terms of treating TB as well. Even the more difficult forms of TB, like your MDR and XDR TB, so people can get cured. We need people to take it seriously if they have the symptoms, and we're talking specifically prolonged cough, loss of weight, night sweats. Those are the most common ones that link to TB. Anybody that has come into contact with a TB person also needs to be then investigated for TB, what we call contact tracing, to close the loop and thereby get as many people on treatment as early as possible.
Dr. Mohammed Rasool, thank you very much. Sorry, you wanted to add something?
Yeah, I just want to say we must not give up the fight on this. We need to persist, because that's the only way we're going to get control of it. If we let it slip, then unfortunately we're going to have bigger problems down the line.
Doctor, thank you very much for your time. Dr. Mohammed Rasool, Deputy Director at the Clinical HIV Research Unit. Thanks indeed for your time. When we return, more news from the local front and from further afield. You're watching Newsfeed, the AIM edition.